Today, we are breaking down the differences between the PAP, the colposcopy, and the LEAP procedure. First, the Pap smear. As most of you know, this is a routine cervical cancer screening test. Your doctor will use a speculum. Imagine all around it is the vagina, this is the cervix, and this is the external cervical os, the hole that goes into the cervix. It's a tunnel all the way into the uterus, which would be right here. When your doctor does a Pap smear, they take a spatula and they sample around your cervix. Also something called a cytobrush, which is used to collect cells from inside of the cervical canal. They'll do a slight scraping. That sample is sent off to the pathologist to examine. But then, your doctor calls you and says, came back abnormal. Unfortunately, I need to bring you back to take a closer look. Then what she does is a procedure called a colposcopy, using a large microscope to look closer at your cervix and to examine it to see if there are some hidden cells there that we didn't pick up on your Pap smear. We're looking for higher grade cells potentially that could lead to cervical cancer, or in some cases, cervical cancer itself. Before the colposcopy, your doctor may give you some local anesthesia, which could include lidocaine gel or lidocaine spray, and sometimes a paracervical block, which is injections around the cervix. And this procedure is relatively quick, and the biopsies are extremely small. Nothing larger than something of this size. Your doctor will also again do a scraping inside the canal, but no large chunks are taken, just small little pieces. This is sent, like the Pap smear, off to the pathologist to examine. You hope everything's okay, but unfortunately your doctor calls you back and says, we have a problem. The results of these biopsies came back for high-grade or cervical cancer, and now we need to perform another procedure. That is called a LEAP, or a cold knife cone biopsy. You think to yourself, what is that? What are we gonna do? The reason why your doctor will do something like this is to preserve enough cervical tissue, keeping in mind you may plan in the future to have children, and taking too much cervix could increase your risk of preterm delivery. So your doctor's goal is to take as much tissue as necessary to remove all the abnormal while preserving enough of your cervix to decrease this risk. A cold knife cone is when a special trained doctor uses a scalpel to cut around this area and remove a piece of your cervix. This procedure, while very precise, is also at increased risk of bleeding, could be very painful. So this is usually done in the operating room under general anesthesia. The other option would be a LEAP, which is a loop electrosurgical excision procedure. This is when we use a wire loop in the office under local anesthesia. Again, we will do a paracervical block, injecting around the cervix to numb the area. When it's done properly, this is extremely effective. Patients are usually as comfortable as possible. Then we use this electrocautery device. We'll cut around the cervix. The goal is to remove enough of the abnormal tissue with a little bit of normal tissue, which are called clean margins that surround the abnormal areas. The clean margins around the abnormal tissue will ensure that we most likely have removed all of the abnormal tissue and that none remains. The tissue that is removed will be sent off to pathology and it'll be examined similarly to the biopsy and the Pap smear. And the pathologist will make sure that we have removed all of the abnormal tissue. Rest of the cervix may look a little funny for a little while, but eventually it does go back to normal. Now this procedure, the LEAP, is clearly a little bit more invasive than the colposcopy procedure. That's why doctors sometimes will offer general anesthesia under light sedation for certain patients very anxious about the pain involved in the procedure. Could be dangerous if the patient moves, and of course that isn't safe. Otherwise, this can be done in the office, again under local anesthesia, very effectively and with good pain management. I hope this was helpful. Let me know if you have any questions.